Da-da. Thank you for joining us. In this session, we're going to explore the benefits of halotherapy and how it can successfully be used on both pets and equine. We're very lucky today. We have Marlene, who is or has been a veterinarian for nearly 40 years now, with the last 20 plus years practicing integrative medicine. So welcome, Marlene. Thank you for joining us.
Nice to be here. Thank you.
Perhaps we could just start with you telling us a little bit about yourself and how you came to be involved with the holistic side of veterinary.
So like most people, there's some big event that happens in your life that takes you on a trajectory path that you didn't expect. So I'd been practicing as a veterinarian for almost 20 years, and we were showing horses with my two daughters and myself, and my youngest daughter had a riding accident in the arena with one of our show horses, and the horse literally saved her life. So what happened is the horse was getting neck spasms. We didn't know that's what it was at the time, but she ended up having a spasm in the arena, and it caused her to rear up in the air. And when she reared in the air, my daughter was never told, get off your horse. The number one cause of a rider's death when a horse rears is being crushed when they land on you. So we had a 2,000-pound horse and a 50-pound 10-year-old child. So it really could have been a disaster. So when Lily reared in the air, my daughter was literally dangling from the reins and pulling her over backwards. So she didn't have a choice. She was going to go over backwards. And you could see what was going to happen, but no one could tell if my daughter was going to get injured or not. Well, what happened is Lily squatted on her left hind leg, and as hard as she could, you could see her doing it, she pushed herself in the opposite direction of where my daughter was falling. Now, she didn't have a whole lot of time to do this, but when she hit the ground, you couldn't see space between her and my daughter. A couple seconds later, she caught her breath. The horse got to her feet. My daughter wasn't moving. So I jumped over the arena and I'm running to my daughter, honestly, not knowing what I am going to find. And thank God she was fine. The only thing she hurt was her pride. But back at home, it happened a couple of more times where this neck spasm occurred. So I had equine veterinarians come out and look at her, and they said, Dr. Siegel, we don't know what to tell you what's exactly wrong with her. We don't know, but we'll tell you she's not safe to ride, so she'll never be shown again. And here's your two choices. You can put her out to a pasture or you can put her down. Well, that was not an acceptable answer. And at that moment, something woke up inside of me and said, there has to be more answers. And I was willing to do whatever it took to fix this horse, not just so she could be shown, because she saved my daughter's life. They were like best friends, and I was going to get an answer. I was going to fix this horse. And so that led me into starting with chiropractic work, and then I went into acupuncture, and then I went into nutrition and herbs and reducing inflammation, and it just took me on a lasers and all these other trajectories, and it opened up a world for me of possibilities. So everything I learned, I started incorporating into my small animal practice. And I started seeing what people would call miracles, because they were outcomes that in 20 years, I'd never seen outcomes like that before. It was amazing recoveries, amazing healing, really healing at the root cause. So from there, I just started incorporating more and more things into my practice. And everybody always asks, what happened to Lily? And Lily is still alive to this day in my backyard. She is one of my yard ornaments, but she's happy and healthy in our backyard. P.S. 5 months after starting this journey to heal her, she and my daughter won the United States Youth Reserve National Championship, which is the most prestigious horse show in the United States. So when people say there's nothing more that can be done, this is it, you have no other hope, it's not true. It's just finding the right tools. And so very passionate about, in fact, I have online programs, which we'll talk about later, which is called Transforming Vet Medicine. So for listeners, if you go to transformingvetmedicine.com, it was really birthed because people needed more tools in their toolkit. Veterinarians need more tools in their toolkit, because we just can't meet the complexity of disease today with the same limited toolkit that we were taught in school. In school, we were taught to look at a symptom, you name it, you blame it, and then you come up with a pharmaceutical for it. Doesn't work anymore. We have so much more complexity, and we have to start really understanding the body's biology and supporting the body's biology so that we can allow the body to heal. What a novel concept, right? So I have a program for pet parents so that they can be empowered to learn what is it that I need to do to help my pet live a more thriving, longer, healthier, vibrant lifestyle. Because honestly, our pets should live into their 30s, and our big dogs barely make it into their teens. In fact, they're living 7 years shorter today in 2021 than they were living 20 years ago.
Wow.
Yeah. So with all of the pill for the ill, the diet for the disease, we're going backwards on longevity. And those that are living out longer are not living a healthy lifestyle. They have every ailment you can think about. So we really need to have a different way of looking at things. And then as I went through my journey, one of the most important things I learned was detoxification. And it's pretty funny because when I'm talking to veterinarians, I will literally ask them, what are the 6 organs of elimination? And 99% cannot name all 6. They figure out a couple of them because it's kind of obvious, but they can't name all 6. And the reason is because we weren't taught to identify them, because we weren't taught the biology of them so that we could enhance their work. So it's very important. That's a lot of my work is in detoxification, which brought me to halotherapy, because that is the best detox for the lungs and the whole respiratory tract.
Fantastic. I mean, what an incredible story. And I'm glad your daughter's okay. And
Thank
how
you.
impressive that they went on to win. So that's
Yeah.
fantastic. Now, I know you've got some slides that you've prepared. So if I pop those on the screen and
Yeah, while you're loading them up, I find that a lot of this is really new information for a lot of people. And so having something visual to connect to just makes it a little easier. So we're going to talk obviously about halotherapy today, and that's going to be our focus. But I mentioned that in Western medicine, you go to the next slide, the problem that we've incurred is that we've only learned to identify symptoms. So when people get a headache, the first thing they do is they go for the aspirin. They never stop and ask the question, why do I have a headache? And when our pets get ill, we're not stopping and asking, why is that symptom being expressed? We're just trying to mask the symptom by giving the pill for the ill, the diet for the disease, and then we never address the root cause. So what happens is it comes back either as a relapse or as something that's even worse. So I developed the 6 keys to health and healing, and I'll give you a link to actually download it for free at the end of this presentation. But these are the 6 steps that I follow for every single case, whether it's a new puppy or kitten that's coming in for the first time and I want to keep them healthy, or it's an animal with cancer at the end stage degeneration and I want them to heal. So step number 1 is we've got to stop doing the things that are causing the problems. I know, as ridiculously common sense as that sounds, we don't do that. So we have to stop polluting the body in all the ways that we have created the pollution. So that is a species inappropriate diet when we're feeding things like kibbles and canned food, highly processed food to our animals, so bad for them. Water, I don't know what the water like is in the UK, but here in the United States, we have really severe water problems with toxicity, a lot of chemicals, a lot of pollutants, and it's not structured water, which is another whole topic. But trust me when I just say it's not structured water. And then we look at the home environment. Is there mold? Are you using chemicals in the house? Are you using toxic air candles and air fresheners? And what are you cleaning the floors with? Because your pets are mopping that up. They're laying on it. What are you washing your laundry in? Is there a lot of xenoestrogens that are estrogen mimicking compounds? All of these things are creating toxicity and stressors on our pets. And then electromagnetic frequencies. I know that you have a lot of over there, just like we do. That's your Wi-Fi, your computers, your cell phones, all your smart appliances, horrifically imbalancing these animals' electrical systems, so it's really interfering with their metabolic pathways. And then last but not least are the ants that live in our human brains, and that are the automatic negative thoughts that are creating these negative neurochemicals that our animals then entrain to that. So we really have to start looking at how do we reduce pollution? How do we reduce stress? How do we reduce toxicity? Then number two is we want to make sure that the animals have all of the essential nutrients that their bodies need to do their job. You know, we are this one big metabolic vat of pathways going on. And there are certain things, we call them essential nutrients, that the body cannot produce on its own in sufficient quantities. So we have to get that from our diet. And at least in the United States, I can tell you that our farming practices for the past 100 years have been very insufficient. So the foods that we are growing on our lands are typically very nutrient depleted. Whatever is eating that plant, whether that's you directly or the cow that your dog is supposed to be eating, whatever that looks like, if you're nutrient depleted and you're not getting it in your diet, you're going to have metabolic problems. Number three are the importance about healing the gut. I think a lot of people now know what leaky gut is, and that's the permeability lining in our GI tract that is supposed to separate the outside world from the inside world. And it only allows in the right molecular size of a molecule so that you minimize the amount of the work that the liver has to get rid of toxins. So when that permeability membrane becomes leaky, then toxins can come in. Here's Kitty. By the way, let me just tell you, this guy's 20 years old. So will you come into the picture? And if you can appreciate it, his coat's shiny. He's got no muscle wasting. You know, say hi to the camera. And he's 20, but he is a raw food eater and has for many, many years. And he's as vibrant now as he was when he was a 2-year-old. Okay, so we were talking about healing the leaky gut. When we do things that inflame that membrane that separates the outside world from the inside world, then toxins can come in. They are then carried to the liver, who sees this as a foreign invader and mounts a cytokine storm. It's an inflammatory response to get rid of the invaders. That's fine. That's what it's supposed to do. But if every day, multiple times a day, every bite of every meal, toxins keep creating more leaky gut and more inflammation is produced as a consequence, then it's pretty easy to see that you're going to have this, before long, you're going to have this hamster wheel that's just going around faster, faster, faster. And then number 4 is detoxification. This is where halotherapy comes in. So we want to detoxify the 6 organs of elimination. We have the kidney, the colon, the lungs, the liver, the skin, and the lymphatics. So halotherapy actually plays a role in both the lungs and the skin. So when that salt drops down onto the skin, if you have ulcerations or infections or seborrhea or whatever abnormalities on the skin, that salt therapy actually can go in there as a disinfectant and help clean up the infection. And same thing for the respiratory tract, everything from the nares to the sinuses, all the way down into the lungs. Number 5 is the mitochondria. We want to make sure that these are the powerhouses that produce the energy in our body. And they do a lot more than that. They actually produce the communication between the microbiome, all the organisms that live within us, and the cells. So they're really sending signals. They're helping to tell systems when to turn on, when to turn off. They're doing a lot of work in there. And consequent to that, they're also producing redox signals. There's so much information. And the more energy they produce, the more information that they can do, the better our bodies are going to be able to respond. And 6, last but not least, is with all dis-ease, there are always emotions that are associated with that, these low vibrating emotions. So in my work, we also clear trapped emotions. So as we go through seeing some of the cases and how it works, I want you to be really mindful that we are not using halotherapy as the alternative way of doing a pill for the ill, right? That would be wrong. All of these complementary and alternative therapies are part of expanding a toolkit so that we can be more effective in helping the body to heal. But go back to the beginning. If you keep doing the lifestyle that's causing the problem and you are nutrient deficient and you have a really inflamed, leaky gut, I don't care how much detoxing you do. I don't care how much drugs you take. you are not going to overcome that. And our pets are in the same position. So when we really want to affect true healing, we need to have a lifestyle. It's a way of living. It's not something you do once in a while. This becomes who you are. Good?
Yes.
All right, so let's go to the next slide.
Oh.
All right, so this is what I have in my office. I have a booth. We are in next year, we're going to be launching Spas Family Wellness, and they will be a franchise in the United States, and hopefully they will become worldwide, but they're detox centers for pets and their parents. And in the spas, we're going to have combinations of specially built halo booths and halo rooms so that people can go in with their pet and be able to receive these services. So on the left, you see my daughter is in there with a cat, and on the right, there is a kitty cat who we're going to see him as a clinical patient in the next slide.
Brilliant. My dog absolutely loves my salt room. I mean, he's so relaxed when he comes in there. I think he'd spend all day in there if I let him.
They know what's good for them. All right, so this is Beavis, and Beavis came to us as a feral cat that somebody had found and adopted him, and he had an upper respiratory tract infection, which for most of these kitties, when they come in traditionally, they become chronically infected in their sinuses, and they become shedders for the rest of their life. So these guys typically will go on to be very ill for most of their life and infect everybody around them. So we put him in the salt booth along with doing rectal ozone, and we put him on a raw diet with some fermented food. So he had his probiotics, and in 3 days, this is what he looked like.
That's a different cat.
I know. And he was bright and happy and alert. You almost have to go back and see it side by side, because he was that miserable on day 1, and this is day 3. And this has been several years now, and he has never had one illness for the rest of his life. And he's probably, I don't know, 5 years old now. Yeah.
Amazing. What a transformation.
Yeah, so that was upper respiratory tract infections. The next kitty was a cat that actually came from the UK. He was from France, and the owners had moved into our area, and he had developed this really chronic sinus infection. You can just see the snot in his nose. And she had been to 2 different veterinarians who had put him on massive amounts of antibiotics, and this thing did not get better. And when cats can't smell, they don't eat well because they're driven by their sense of smell. So he came into me. He was also AIDS positive, and Bobby was a little bit of a challenging personality, i.e., he would bite you, scratch you, and was not really grateful for all the work that we did. So we had to be careful about what we did. And if we really needed to do more invasive stuff, even just doing lymphatic therapy on him, we had to anesthetize him to do that. So the next picture shows him in the salt booth with his mama. Oh no, that shows the severity of the snot coming out of his nose. His mom would get these pictures for me, and it was really unbelievable how congested he was. So here he is. He came in, I think November was when he first initially presented. So we were doing a few months of salt therapy. And in April, he was doing fantastic. All the snot was gone. He was eating, he was doing great, but he started suddenly coughing. So we took some x-rays, and on the next picture, I think we'll see the x-rays. Oh, the arrow got off, but yeah, there we go. So we ended up diagnosing him with a lung tumor. And we continued doing his therapy, and it was really ironic. In addition to salt therapy, we were doing ozone and a variety of other things. His mom was really into essential oils. We were using some homeopathy on him. And in under 3 months, his tumor was gone.
Wow.
His lung tumor was gone. We couldn't see it radiographically. All right, so let's see what we got next. Oh, there's our happy kitty. What a difference. And can you see how brighter his eyes are? And he's just, you can tell he's more vibrant. He's not laying there gasping to try to breathe and have all this snot come out his nose. So he must have felt miserable. We feel miserable when we have all that congestion.
Wow, what a difference again.
Yeah, pretty amazing. So this is Chikari. She was a 10-year-old female spayed Rhodesian Ridgeback who was diagnosed at a referral center in April of 2019 with a squamous cell carcinoma in her nose. And so we The owners did not want to go through traditional therapy, so we started working with her, and we only treated her twice a week. When she came in, we would do salt room. She did infrared sauna. We did intravenous laser therapy, photobiomodulation is what it's called, and a variety of other things, lymphatic therapy. She had a lot of different things going on. And we also had her, of course, on a raw diet and the right supplementation and a lot of oral supplementation to kill cancer. During the process, it took 16 weeks. Let me see what we have for our next slide. And in May and June, her nose got worse. And I put this in here because I want people to realize that when there's a cancer, it doesn't just poof go away, right? You have to activate the body to recognize that it's there. And it's not what we're doing that kills the cancer. It's the body's innate immune system that actually gets reactivated and in a sense goes, oh, look, there's something abnormal there. I didn't see you before. I'm going to take care of you now. And so it goes in and it creates a reaction in this abnormal tissue. And it actually went over to the left nostril in addition to the right nostril. So we kept going, though. We were absolutely determined this was going to go away. And in July, 16 weeks later, she was cancer-free and has remained so. We're in the end of 2021. So it's been 2 years and she still has no evidence of any cancer in her nose.
Incredible. I guess that goes along the saying of you have to get worse before you get better almost.
Yeah, kind of like that. But it's what it's really doing. You're reactivating the body to recognize that there's something that doesn't belong there. And then you're giving the body the tools with which to take care of it. But one of the tools we used for her, since this was in the respiratory tract, was halotherapy.
Brilliant. And then we have another dog.
And then we have Max. So Max came to me with a horrific back infection. The person called up and said, my dog's got a skin infection. It's getting worse. It's not getting better with what I'm doing. Can I bring him in? And when he brought Max in, we didn't know what had happened to Max. All I knew was as I went to clean off the hair on his back, the skin just sloughed off. It was dying. So we biopsied him and it came back that he had been left out in the sun for an entire day in Florida without any shade. He was a black dog and he developed severe sunburn. We didn't know that at the time. At the time, it just smelled so bad because his skin was rotting off and he had it was a Pseudomonas infection that he had in his skin. So every day, Max went into the salt booth and he received ozone therapy and laser therapy. Go to the next slide. And here you can see a technician is lasering him and she literally had to wear a mask just to keep the smell down because that first few days, it was pretty horrific. In this case, I did actually use antibiotics because his culture came back with a Pseudomonas infection. And then we treated him every day. He actually stayed in the hospital. Here's the remarkable thing. Go to the next slide. See how his skin is literally like a turtle shell breaking off. And yet he was the happiest little dog. He was on no pain meds other than the lasers and the ozone and CBD, the things that we were using. And that actually was enough to keep him very comfortable. So not long after this, the skin sloughed off. I won't share that slide with you, but here it is about to be actually lifted off. And in the next slide, you're going to see what was so remarkable about this was how healthy the tissue was underneath. So we look for the reparative tissue, the collagen and all of that reactive tissue to be healthy. And so here you see that after the skin sloughed off, what was underneath, because we had treated him so effectively with all of our therapies, was very healthy granulation tissue. And then within a week, from the left to the right was just 1 week. You can see it shrunk down 50%. And then within a couple of months, it was all gone. And the very last slide shows him fully healed. And it was kind of interesting because that's the United States on his back. So that little tiny piece at the lower right, that's Florida.
Well, please, anybody who's watching, make sure your pets have shade.
Yes. And, Florida is pretty hot. So that was pretty intense. So the next slide is just different contacts for me. If people want to contact me, my courses are online, so you can access them. And of course, we're here to help as many people as we can to get information. And I think that's really the end of the game. There's two things that happen that leave people in a bad state where they don't have the tools, they don't have the ability to do any better. And that's number one is knowledge. Okay, so knowledge is power. And if you don't know what you don't know, then you're not going to get any better. So number one, we want to educate people on what is available. And then number two is implementation, right? Because you can learn all this stuff. And if you don't have the ability to apply it, if you don't integrate it into your lifestyle, if it's overwhelming because there's so many things that you have to change, then you end up doing nothing. So in my programs, and I do teach internationally, I help them to learn what they need to do. I literally tell them to take a piece of paper, fold it in half, make column A, column B. Column A are all the things that they should be doing, but they haven't learned to do them yet, but they're learning it in the course. Column B are all the things that they shouldn't be doing, but they still are because they haven't learned better. So column A, what you should be doing, column B, what you shouldn't be doing. This is not about blame and shame. It's not about pointing fingers. It's all about learning, right? Everything happens for a reason. It really does. And the pet that you have at this time in your life with whatever condition that it has is there for a reason. And I think this empowerment, this awakening to the fact that we are really responsible for our own health and the decisions that we make, and nobody else is responsible for that. And when we start making better choices, how we spend our dollars, which product we pick up, which lifestyle we choose to have, when we start making those changes, it not only improves our lifestyle, our two-legged children, our four-legged children, but it actually helps Mother Earth. So I'm pretty passionate about helping people to awaken to the fact that we do have tremendous power. We are the co-creators of the universe, and we just have to decide what is it that we want to have, and then we focus on that.
Absolutely. I mean, wow, what a presentation. And those slides, they got me right here. I've got pets myself. I've got a dog and two cats. I've got a very hyperactive dog who just has way too much energy and loves licking us and cuddling us. But I think he was just sent to me as a third child. But it's really, really interesting. And I'm so pleased that halotherapy has become part of the process and is being used to help all these other treatments kind of fulfill the whole cycle and bring animals back to how they should be. I can't believe that animals should be living to 30 years. That's new to me.
Yeah. There's a cat in the World Guinness Book of Records that lived to 38 and 3 days. And there's a dog in Australia, Maggie, that lived to be 30.
Wow, that's amazing. Because as you say, most people, when you ask when their pet died, it's in their teens, isn't it?
Early teens.
Yeah.
If they even make it to the early teens. And we think of aging as a disease. It isn't a disease. I'm in my mid 60s and I refuse to age. I don't think aging is a disease. I think it's how we take care of our body. It's our mindset. It's our activity levels. It's how we live our lifestyle. So I think once we take ownership of that and we don't give our power away to others or companies or products, and we say to ourselves, what can I do as a decision? We have Earth School that we're in, and we have an Earth suit, and that's the only one we get. And are we going to take care of it? Is the valuable thing that it is, or are we going to damage it? And I really think about everything that I do in my day and how I do that. And I know that the microorganisms on and in my body are so important that I want to support them. I want to give them a good environment. It's all about the terrain. So when I'm eating food, I'm literally thinking, have I fed my microbiome before I feed me?
Well, you're clearly doing something right.
Well, thank you.
I was trying to work out how you'd been in veterinary for over 40 years and looking like you do. So I need to get some tips, that's for sure. I'm going to be reading your handout, definitely. Well, this has been absolutely brilliant, really, really interesting. And there is a link on the page for people to click on to jump onto your website and contact you. So thank you so much for joining us today. We appreciate your time.
Oh, thank you so much for putting this on, because I could have all the messages I want, but if I don't have platforms to share them on, then it doesn't get out to the world. So thank you, everybody. I
Together we
love
can
Europe. Can't wait to get there again when the world gets a little crazy.
yeah,
That's
yep.
crazy.
And together we can make a difference. That's right. Thank you.